Good afternoon, ma'am. I'm Mostly Gilligan, taking a Bachelor of Science in Nursing at the University of Southern Mindanao, second year. This time, I'm going to perform a return demonstration for starting an IV infusion. The first procedure is to verify the IV solution order in the MAR or CMAR with a medical order, check for any inconsistency, as well as the patient allergy. This is to ensure that the correct IV solution and the rate of infusion is being administered or infused. Then check for color, leaking, and expiration date of the IV solution, and know the techniques, precautions, purpose, as well as the medications ordered. That knowledge and skills is necessary for a safe intravenous infusion and preventing error. Then assemble all the equipment and bring it to the bedside. This will save time and facilitate the completion of the procedures. Then perform hand hygiene and put on additional PPE if indicated, because hand hygiene deters spread of microorganisms, and personal protective equipment is necessary according to transmission precautions. Then the next procedure is to identify the patient, because patient identification ensures that the correct patient received the intervention, and it will prevent error. Then close the curtains around the bed and the door of the room if possible to provide privacy to our patient, and then explain the procedure to our patient, what you are going to do and why you are going to do it. Also ask the patient for any allergies. The rationale behind that is that explanation relieves anxiety and promote cooperation to the patient, and some patient may have allergy to the IV solution or medications and to the tape used to anchor the devices. Then to prepare a administration set in the IV solution, we have to compare the IV solution container and the MAR or CMAR to ensure that the correct IV solution is being prepared. Then check for expiration date to prevent error. Then label the IV solution container with the name of the patient, the type of the solution, the additives, date and time. This will help the other healthcare provider to know what type of solution being infused and when it was infused. Then the next procedure after that is to maintain sterility or aseptic technique in opening sterile packages, including the IV solution. Then remove the administration set and the packaging. Asepsis is needed to prevent the spread of microorganisms and prevent contamination. Then apply label the IV tubing reflecting the date or the day of the next set change. It adheres to the agency protocols regarding the administration set change. Then after that, we have to close the roller clamp or the slide clamp of the administration set. This is to prevent air and fluid in moving into the IV tubing. Then invert the solution and remove the cap on the opening side. Make sure not to touch the exposed side on the opening side. The rationale behind that is it will allow us to have an easy access to the IV solution, and it will and touching the open area of the intersite will result in contamination. Then remove the cap of the spike on the administration set. Then using twisting and pushing motion, insert the spike of the administration set into the intersite of the IV solution. Inserting the spike of the administration set will puncture the seal on the IV solution, and therefore we will have access to its content. Then after that, we have to hang the IV solution on the IV pole. Suction will cause the fluid to move into the IV tubing. Then after that, we have to suction will cause the fluid to move into the drip chamber. Then after that, we have to squeeze the drip chamber and fill it at least halfway, because fluid will prevent air in moving down the tubing. After that, we have to open the IV clamp and fill the tubing with the fluid until all air bubbles have disappeared and until the entire tubing is filled or primed with the solution. Because this technique will prepare the IV solution administration, and it will remove air from the tubing, because in large amount, if air is not removed, it may act as an embolus. Then after that, we have to close the clamp. Remember that some brand of IV tubing may require cap removal at the end of the tubing to allow fluid in moving. Then we have to maintain sterility. Then after the entire tubing is filled with the solution or fluid, we have to close the clamp. The rationale behind that procedures is that touching the open end of the tubing will result in contamination, and the administration set will be discarded. Then to initiate a peripheral venous access, we have to put the patient in a low colors position in bed, and we have to place a towel or pad under his or her arm, because supine position will allow us to um, will allow us to use either of the arm, and then the towel will protect the underlying surfaces from blood contamination. Then we have to provide emotional support, because some patients may have anxiety, as they have fear in the needle stick or the IV solution in general, or IV infusion in general. Then the next procedure is to label the next procedure is select and palpate an appropriate vein, because selecting the appropriate vein is necessary to minimize patient discomfort and prevent the risk of or the damage in the body tissues. Then we have to if the site is hairy and the agency protocols permit, we have to clip a 2 inches area around the intended site, because hair uh, may harbor or can harbor microorganisms, and it will prevent the adhesion of the dressing. Then put on glove to protect the nurse from being in contact with the blood or other body fluids. Then apply tourniquet 3 to 4 inches above the venipuncture site to obstruct the blood flow in the distinctive vein. Remember to direct the tourniquet away from the site, and make sure that the radial pulse is still present. Interrupting the blood flow to the heart will cause the will result the vein to distend, and directing the end of the tourniquet into the needle insertion site may result in contamination. Then assessing the radial pulse is important, because the tourniquet may be applied so tightly, so checking the radial pulse is necessary to ensure that the arterial supply is not compromised. Then after that, we have to instruct the patient to put the arm below his heart, because this level will distend the vein by filling them. Then ask the patient to open and close the fist, then observe and palpate for suitable vein. The rationale behind that is contracting the muscles on the arm will force the blood to the vein, and therefore distending them further. But if the vein is not palpated or not filled, we have to massage the patient's arm from proximal to distal end, and then gently tap over the intended vein, because massaging and tapping will help the vein to distend by filling them with blood. Or remove tourniquet and apply a warm, moist compress over the intended site. Warm and moist compress will dilate the vein, therefore distending them. Then after that, we have to cleanse the area with antiseptic solution in a back and forth scrub friction for at least 30 seconds, for 30 seconds. Then we do not dry or blot, then allow it to air dry completely. The rationale is that microorganisms on the surface of the skin may be introduced into the tissues in the bloodstream when we insert the needle. Then place the using the non-dominant hand, place it 1 or 2 inches below the needle insertion site to hold the skin taut against the vein. Then remember not to touch the prepared area, and instruct the patient to remain still while doing the venipuncture. The rationale behind that is the pressure in the tissues and the pressure in the vein and surrounding tissues will prevent the vein in moving while inserting the catheter or the needle, and touching the prepared area with a non-sterile hand will prevent in contamination, and patient movement while doing the venipuncture may prevent the proper techniques of inserting the needle or the catheter. Then after that, we have to after that, we have to enter the skin gently by holding the catheter on its hub with the non-dominant hand. Then in bevel side up and 10 to 15 degrees angle. Then insert the catheter from, from directly over the vein or from the side of the vein, and following the course of the vein, advance the catheter into the vein. The rationale behind that three procedure is that it will allow the needle or catheter to be inserted in minimal trauma and prevent the passage of the catheter through the vein. Then when the blood returns to the lumen of the needle or to the chamber of the catheter, we have to advance the catheter through the vein until its hub is on the venipuncture site. The rationale is that the tourniquet increases the venous pressure, therefore there will be an automatic backflow, and automatic backflow indicate that we have entered the vein. Then after that, we have to release the tourniquet and apply and stabilize the area with our non-dominant hand. Then remove the protective cap on the tubing and anchor it or connect it with the catheter, being careful not to touch the point of the site of point of connection. Then secure the connection. The rationale behind that is bleeding is minimized and the patency of the vein is maintained when the connection between the catheter and the tubing is made smoothly. After that, we have to making connection, we have to begin the primary infusion by slowly opening the roller clamp or the slide clamp. Then inspect the site for any sign of infiltration and leaking, because this sign indicates that the insertion is unsuccessful and need to be discontinued. Then after that, we have to open and apply. We need to open and apply a skin protectant to the site, making sure to cover at the minimum all the area to be covered with the dressing, because skin protectant will aid in the adhesion of the dressing. Then place a sterile and transparent dressing, because transparent and sterile dressing will allow us a better visualization and protect the site. Then loop the tubing near the site and anchor it using the non-allergenic tape close to the site, because the weight of the tubing is enough to pull the catheter out of the vein if it is not well anchored. Then it will if it is not well anchored. Then the next procedure is to if infusing by gravity drip, we have to adjust the roller clamp to the or the flow rate to the we have to adjust the flow rate until the correct drop per minute is achieved. This is to ensure that correct volume is will be administered to the patient. Then after that, we have to label the dressing with the date, time, site, type, and size of the catheter being used. This is to allow other personnel working with IV infusion to know the type of devices used and when it was inserted. Then apply a IV securement and or stabilization device and explain its purpose to the patient, and as well as explain to the patient the importance of safeguarding the cycle using the extremity. The rationale behind that is the securement or stabilization device will maintain the integrity of the access devices, and then it will prevent the devices from being, or it will prevent the catheter migration and access loss or the catheter to be dislodged. Then after that, we have to remove all the equipment and make the patient comfortable and position the bed in its lowest position. It will promote safety and comfort to our patient. Then dispose all the stylet or other sharp object in the appropriate sharps container. Then discard the supply. Remove the gloves, and the additional PPE if used. Then perform hand hygiene this to appropriately prevent the spread of microorganisms and prevent contamination of other items. Then after that, we have to document all the necessary information in the patient chart. Then return to check the flow rate, to check the flow rate after to check the flow rate and the sign of infiltration after after 30 minutes of infusion, and at least hourly thereafter. Then ask the patient if she experiences any pain or discomfort regarding the IV infusion. The rationale behind that is continued monitoring is necessary to ensure that the correct flow rate and early detection of the problem will ensure prompt intervention. Then that's all for intravenous infusion. Thank you.